Did you miss us? Because we were, took a little break for a week. I hope you all missed us here at Interesting AF or Interesting as Fuck. I am one of your hosts, Linda, and I have my co host, Elaine, here. And we are now going to be our topic this week because I don't think we went into it last week. Last time we did kind of a hello, this is who we are, kind of a welcome redux, as we called it. And today we're back to our regularly scheduled programming of learning about stuff. And Elaine came across an article, and we wanted to keep doing that, kind of format that we had done in the past, where one of us reads an article and the other one kind of discusses it with the other. Um, it's like that kind of thing when you send an email and you're like, if we don't hear from you,
Yeah.
keep going.
We like it, so we're doing it.
I like it. And it's our show, so whatevs.
Exactly.
All right. Well, Elaine, take it away. Tell us this article and what you've learned and how we can apply it to kind of everyday life.
Yeah. So came across this article from The Upshot, which is a part of the New York Times. This was written by Claire Kane Miller and Ireneo Cabreros. I apologize if I butchered your first name. But I just thought this was super interesting, especially because, there's a lot out right now about like 5 years since COVID and lockdowns and all of that. And kind of why we started this podcast, right? Was like, we're coming out of COVID. If you're younger and you were just entering your career at the time that it was weird to be around people and, just how to converse and connect with people is kind of what this is all about. And so this article, The 15 Lessons Scientists Learned About Us When the World Stood Still, is the title. The pandemic gave researchers a rare opportunity to study human behavior. Their work offers lessons about loneliness, remote work, high heels, and more. So, excuse me. There are 15 lessons on here, and one of the things I wanted to put Linda on the spot for and see how this conversation comes about. And if it goes really well, maybe this has to be a two-parter. Or if it's going terribly, I'll just read all the 15 to you.
It depends on how my brain is doing today.
Yes, which like on any given day, like our brain is spot on or mush. So
50-50. 50-50.
But I would be curious to hear some of your guesses as to what you think is on this list.
Okay.
So start one by one, because I think there are some that you'll definitely guess.
Okay.
And then there are others that are just super interesting.
All right.
So,
and full disclosure, I had seen this article, did not read it. I should be commended for not reading it because this is the type of pretentious bullshit I love.
That's
Linda is all over it.
That's just learning and knowledge.
Linda is all over it. Anyway, but I would think that number one is...
You don't even have to do it in order, because I don't think these aren't necessarily ranked. But I'm curious to know like what you think is on this list.
So I would think loneliness went up really like a lot. People did not connect with other people, and therefore we had, increased loneliness. And every time there's increased loneliness, there's increased disease, there's increased alcoholism. Like there's all these like factors that happen. So one, I think we just got lonelier. We didn't really use materials that we have like WhatsApp or like calls to actually connect to people. Cause fine, we couldn't connect face to face, but you could still connect, right? I think it exacerbated, and I bet you some populations were more lonely than others. So probably like older ones, like maybe new parents were like the lonelier cohorts. Because those are probably the ones that did not want to take the risk of getting sick more than the rest.
So a couple of things you mentioned are on this list, but the big one, I think, which is, it's an obvious one, but there is no substitute for human contact. That was a big one. So globally, Mental health, which was measured by loneliness, depression, and anxiety, got worse during, and so we're, by the way, we're specifically talking about like lockdown, like the worst, deepest, darkest days of lockdown is
Yeah.
really what these pertain to. But because some places were locked down more than others, these studies could kind of go on. But when in thinking about this, like we're talking about the deepest, darkest days of when the world really did stand still. We were locked in our houses. No one knew what was going on. Yeah, globally, mental health went down. It got worse. I think that's a fairly obvious one. Another piece to this, right, is social media was and is not a substitute, and it made mental health deteriorate fast. I think, you're right in terms of older people became very lonely, but there were also, they kind of broke groups out into older and younger. And
Mm.
when you talk about the social media piece, that had a massive impact on young adults, a massive
Interesting.
impact, because you're seeing things that aren't necessarily real life.
Right.
You're seeing things and not being able to converse really with your friends. You're only conversing with your friends through social media. There might be, you know, social media made this world more divisive and polarized during COVID. It really impacted young adults for sure. So yeah, I think that one's a pretty obvious one and should absolutely be on here. But I think it's really interesting that like they measured this globally and that was like
Mm.
a universal fact. Um, that loneliness, depression, anxiety all went, I don't want to say through the roof, but like we all felt it. Even those of us who may not have ever felt it before, like, and or even if you're an introvert, I think if you're someone who naturally doesn't love going out and seeing other people, like even introverts felt it because you couldn't go anywhere.
Yeah.
So, all right, what I'm trying to see if there were a couple of other things you mentioned. So I'll go into this one. You
And
mentioned alcohol. Oh, go ahead.
something that came to me just now when you said social media, people are watching things that are not necessarily true. And I realized that this actually like makes us more susceptible to like misinformation,
Yeah.
gaslighting from like authorities, things like that, because we're literally confront that's why like the rise of certain figures is a lot easier in social media because we're literally exposed to things that we know aren't true,
Yep.
but then where is the truth?
All right.
Right? Anyway, tangent.
No, it's a good
What
tangent. I agree.
alcoholism.
So alcohol, this one had so to your point, alcohol, home alcohol use certainly went up. And with that came, a lot of problems. Domestic violence went up, which
Mm,
is a very unfortunate part of lockdown and COVID. Um, However, on the other side of things, there were some positives in terms of alcohol restrictions saved lives around the world. So there were curfews or bans on the selling of alcohol, and that appeared to save lives. So there's an example out of South Africa. Hospital admissions to trauma units and deaths declined. And in southern India, trauma brain injuries decreased. And they attribute that to people not being out as late, people not being able to buy or drink alcohol and get into accidents. So I thought that was really interesting. Personally, my alcohol consumption, hell, I got my WSET 1 and 2. I knew I was going to be drinking so much wine. Jesus. I was like, we're going to
yeah,
drink all the time. I might as well learn what I'm doing.
I think the only thing that saved me is that I was pregnant for most of COVID,
Right.
like twice. So or
So,
had a baby. So like either or.
so going in that direction, what do you think scientists learned in terms of pregnancy
The
or babies? Anything on the list there?
Oh, yeah, probably. I remember a study going about this that like stillbirths went down or something, like better health outcomes because women would literally like not be moving as much or something. Like there was something where they wouldn't be as exposed to like pathogens. There actually like was a decrease in stillbirths. That one I was pregnant during COVID. So like these are the things And women were a lot more serious, I think, about their prenatal care, even though, even if they couldn't go, they could like do it. They did it because they literally had nothing. So
Yeah,
like
so premature births
births, right?
dropped drastically. And those may have been prevented. The ones that were prevented were likely prevented. It says premature births might be prevented if we just take better care of mom, which, like, you and I are probably like, no fucking shit, Sherlock. Like, no shit. But the numbers of premature babies plummeted
Oh,
globally early in the pandemic when everybody was locked down. Uh, and they think, like you said, it's because staying home benefited pregnant women. They could rest more. They were exposed to fewer stressors, pollutants, viruses. And yeah, women were more serious about prenatal care, going to the doctor. And there's a couple of things on this list that kind of stem from that. But yes, premature births and probably stillbirths. This one was specific
gone
to
premature. Yeah.
premature births, but I'm sure stillbirths also probably went down, um, because if you were pregnant, I mean, I was pregnant not during the initial stages of lockdown, a little bit later on where people could go places, but like we then put ourselves on lockdown because it was pre-vaccine.
Yeah.
And we were like, why would we go anywhere if we don't have to? No one was going to the office. You
Oh,
know,
yeah.
people were still masking. There was still like the 6 foot perimeter. And I was like, I ain't going fucking nowhere. Where are you going? Nowhere. Like,
Nope.
get the fuck away from me big time. And thank God, because my whole first trimester, I threw up every 2 hours. And I do not, I like, I always, of course, had respect for women, especially working women and pregnant women, and not just working women, but like women with other kids who are pregnant, like basically pregnant women of any and all kinds. The idea that I would have been in the office throwing up every 2 hours at 6, 8, 10 weeks pregnant, not telling anybody, who the fuck wouldn't have known, first of all? So like, I, my God,
Yep.
my God.
So my first pregnancy, I actually was not as, and I think we've talked about this. I'm an Olympic level barfer, like
Oh yeah,
Olympic level. Um, and wasn't too, like, I didn't have a lot of morning sickness with my first pregnancy.
good.
I did, like, I had it, but like it was nausea, not necessarily like throwing up, but it was with my second pregnancy where I was barfing all afternoon. I was like not after all afternoon. So then at some point I was like, I'm gonna get on drugs. Give me an
Mhm.
anti-nausea medication. I'm out. Please, women, they're tested. Just take them. Like it's fine. You
The one
don't
I
need
had
to.
a little pregnant lady on it. Like, it was
Same.
specifically for pregnant women. I can't remember the name of it,
Mine
but
was Benesta. I remember
that
mine
was
was
not
Benesta.
mine, but I'm sure if I
But yeah,
thought
there's
about
a
it, I could come
couple.
up with it.
They're tested, everybody. Just don't
Yeah, they're good.
suffer. You don't need to
I felt
suffer.
it was instantaneously
Instant.
helpful.
Oh, so
Like,
one day
oof,
I
put me on a
barfed.
fucking
The next,
billboard.
yes, I'll do
Like,
it. We'll do it. We'll
my
we'll
husband brought
we'll
it
hawk
home.
it.
Oh yeah, my husband brought it home. I literally have been throwing up for every 2 hours for weeks. Brings it home. Within an hour of me taking it, I stopped vomiting. Couldn't believe it.
Yes.
Like, oof, right?
Anyway,
We had to find silver linings of the lockdown and of COVID,
of
right? So
course.
mine was that I didn't have to go to work while throwing up every 2 hours. Thank
Nobody knew. I think
God.
you knew, but nobody knew I was pregnant. I think I had my boss knew, another
Yeah.
of our colleagues knew, you knew, and then after that, nobody knew up until I was 7 months pregnant because I was about to leave.
Yeah, because we're like, right, we're chest up
Right.
on these virtual calls. So
Nobody knew. And then my favorite one was because I got my COVID vaccine during my second pregnancy. Um, I don't know if you got it then because it was like they were
I did. I
starting to
got
roll
it
out of that.
because we were pregnant, we were deemed high risk. And so I got
Exactly.
it kind of right after that first rollout for like the oldest people and the
Exactly.
most high risk people. I got it
Yeah.
during the second rollout. So I think it was like April of 2021.
Yes.
So I was pretty early pregnant too.
I was, yeah, I think it was like April or something. And the lady was like, can you, are you maybe I got it like, May, because I was 7 months pregnant, like May or June. And she was like, "Are you pregnant or in the possibility to be pregnant?" And I'm like, "Lady, like, I'm like, don't you see?" It was very funny to me, but yeah. So, yay for better health outcomes.
I
The
actually
environment.
joined a study out of the University of Washington, for the COVID vaccine with pregnant women. My husband's
Awesome.
cousin is a nurse, and her and I were pregnant around the same time. And she's like, "Would you want to be a part of this study?" I said, "Absolutely, I would." So I actually and they still send me like once a year. They're like, "How's your baby? How are you feeling?" Like even years later, they're still checking in to make sure that there were no impacts. And we good, man. We good
Yeah,
to go.
good to go. I would think one of them would be the environment, that it actually got better because we weren't out driving and doing bad things to the environment. And like, my guess is the environment market. Remember, there was like something where like the whales came back all of a sudden.
So I was
There's
thinking because of this, that could be our next Doc is in, because it's
ooh,
first of all, it's David Attenborough. Who doesn't fucking love
done,
Sir David Attenborough?
done.
It's called The Year the Earth Changed, which I think we'll do as our next. And it specifically talks about the environment rebounding and how quickly it did while we were locked down. It's spectacular. But yeah, the environment, this one is very specific to animals, but
Okay.
I find it really interesting. So this one says dolphins talk more when people aren't around. So animals began breeding more, they were traveling farther. Dolphins whistled longer, birds changed their songs, sea turtle laid more eggs. All of this stuff happened. There's pros and cons to everything. More invasive species decided to come in and take over because people weren't treading in certain places or fishing in certain places, right? And I'm like, I'm not for overfishing the ocean, but like there is a system, right? To a lot of the earth has adapted to what is the system of every day now, right? So, yeah, pieces of the environment came back, but it also showed how the environment needs human beings now, right? Like not in every single case, but
But
in
like
certain
the
places again,
ecosystem,
like where
yeah,
these
the
invasive
ecosystem,
species,
yeah.
yeah, like the ecosystem, right? Like the ecosystem, it came back in terms of the environment for a little bit, but the balance was off because we weren't out and about doing our normal thing. But so yes, that was another one. There's another interesting environmental one since you brought it up, is
Okay.
that trees and plants make people happier, which like seems kind of obvious, but I found that one interesting. People obviously, and I think because of when lockdown hit us, right? Like China was in the middle of winter when they
Yeah.
first had their lockdown. But for us, it was March, April, May, June. People flocked outside and natural areas during lockdown. We had the ability to do that, which was thank the fucking ground earth we walk on because
Yeah.
if it had been getting dark at like 4:30 at night and it was cold and we really couldn't even go outside, I would have burned my house down. Like, like talk about fucking cabin fever.
Oh
Which
my
remember we talked about The
god.
Shining, I would like room 234, 237, like all over the place. Um, and a study in 9 countries found that access to nature, even just a balcony or a garden at home, buffered the stress of lockdown and improved people's moods. And then, of course, there's always, they didn't necessarily get into this, but there is all of that scientific evidence that having certain plants in your home helps purify the air. They just naturally make people happier, right? It because they need sunlight, you're more likely to let some sun into your house, let the light in.
Mm,
So I thought that one was an interesting one.
that's really cool. And so like it's because like plant use went up and then we went out more because we could be outside and things like that. Wow. Yeah, I didn't think
Yeah,
about that one. Really
it's
didn't
cool,
think
right?
about that one. That was
All right,
really
let's
cool.
see. So we've gotten one, two, three, four,
All right.
five. I'm
5.
not going to necessarily make you guess all
Guess all
15, but if you
15.
do,
Um I like vaccines work. Like, is that one of them? Because I mean, like, I hope
so
Like, I mean, we knew that before,
Yeah, we
but,
should
like,
all still know that.
yeah, we should all still know that, but I would think that this was, like, one of the biggest kind of live experiments of vaccine uptake and vaccine, like, side effects because everybody knew, like, it's not like we're rolling out, like, for example, like a smallpox vaccine,
Right,
chickenpox vaccine, right? Because kids take it at different times and they're just sort of cohorts. But now you had basically the entire globe. Well, of course, there were the haves and the have-nots. Some developed, some, countries didn't get access to the vaccine, and we can talk about that until the end of times. But we basically had a long-running science experiment on side effects, uptake, adverse side effects for vaccines, and how basically that mRNA, this new technology, is actually game changing um, for health.
yeah. So, yes, accurate. It was framed a little bit differently, but literally out the gate, the number one, again, these aren't ranked, but the first thing they put in this is flu season doesn't have to be so bad, is the way they
Ah,
say it. So the flu basically disappeared during lockdown, which is true. I
right.
don't I don't know. We didn't get it. No one we knew got it because no one was going anywhere. Also, simple behaviors like masking, washing hands, avoiding social gatherings, getting vaccinated drastically lower flu cases and other respiratory illnesses. I truly think it's like, again, right? Like pros and cons. We weren't sick for over 2 years.
Oh, for 2 years.
However, that's not always a good thing either, especially when you're constantly with the antibacterial, like we're basically bathing in it, right? That's not always a good thing either because holy fucking shit. You already know where I'm going with this. The first daycare sickness that our child brought home took me out so hard, worse than when we had COVID. And luckily we got COVID after our vaccines. Like it still was
Same.
not pleasant, but like
Yeah.
it wasn't as bad as it could have been, I'm sure. But I got a sinus infection that took me out so hard. I thought something was eating my face from the inside out. I had to get on steroids. I had to close down work every day at 2 because I was in so much excruciating pain. And it's because I hadn't been sick, which sounds great in theory because no one likes being sick. But at the same time, I had no antibodies for other things. I had no like my immune system was good because I wasn't getting sick, but it was weak because I wasn't exposed to the germs I needed to be building immunity to. So, man, I got taken the fuck out like
Uh,
back to back to back because we
I
had no
had
immunity.
I didn't have a chance to go to the doctor. I had a sinus infection for 6 months. When I went to my ENT after this, because I was like there was, like, I was just sick on sick on sick. So, basically, sinus infections tend to be secondary infections, right? So, you get whatever, a cold or whatever, and then it kinda, like, mucks up around and then gets infected. So I didn't realize that because my kids get getting sick and sick and sick, and I was like, "Oh, I'm just getting sick and sick and sick." And then eventually in like April, like March or something, like late February, March of I guess 2022, I was like driving my parents to the airport and I was like I couldn't see cuz my eyes were watering so bad and I couldn't breathe and I was like, I'm just going to go to the ENT. And the ENT was like, I swear, this is pulmonary. And he looks down, like, my sinuses, and he's like, how have you lived like this?
Yeah.
This has been going on for months. Like, this is not
Oh,
just like a month old infection. I bet you've had a sinus infection. You've been kicking around for like 6 months. And that's how bad it was. Like,
wow.
I had a raging sinus infection that, like, kept getting reinfected and reinfected
Well,
every time I got sick. And I didn't have because you're a mom and it's, like, hard sometimes to go to the doctor, but I learned that lesson. I was like, "Nope, not doing this again." Every time I'm like, "Oh, this sounds like a sinus infection. I'm out." Yeah.
so
Yeah.
in thinking
The
about,
first time we got the flu was bad.
oh God, yeah. But thinking about like doctor's visits, what do you think changed during COVID with doctor's visits?
Doctor's visits went down. People wouldn't didn't go to the doctor as often, but they went to telehealth. I mean, I bet there's like a twofold thing there, right? People stopped going physically, but there was more telehealth appointments
Yeah, so the
happening.
one they focus on, you're dead on, is that one of the lessons learned is that doctor's visits do not have to be in person. And actually, because of telehealth, healthcare costs went down,
Ah,
right? Isn't that crazy? And it's because people weren't going to the doctor for such minor things. Like they were still going to the doctor for major things, of course.
yeah,
And I think a lot of people didn't go in for screenings when they should have that first year, but people, tended to go back
yeah,
um after a while. But yeah, so people, one example that they talk about is like someone who has very minor appendicitis um wouldn't have gone to the doctor and it would have healed on its own, as opposed to going and maybe them selling you on surgery or something, or
right.
needing drugs to help, so it just lowered healthcare costs because people didn't go in for such minor things anymore,
Yeah.
for a
Okay.
while. So yeah, that's the lesson they specifically talk about is that they didn't have to be in person, and that doctors and patients have come around to virtual visits, and not just to get medicine or get treated, but like for mental health, right? Therapy
Yep.
went online really quickly, and a lot of people now have more access to therapy for mental health because of telehealth, which is great.
Yeah, that's how my therapist, it was all telehealth. I remember before my pregnancy, I went to therapist live. And then after I had my kid, I was like, oh, I need to find a therapist. And thank God it was like telehealth because then I could, you know,
Yeah.
see her whenever I needed to. It was magnificent. Um, yeah, let's see another one. Okay, we went environment, we went some health. There's probably more health ones, I bet. Um, oh, there's probably a work one that Jamie Dimon doesn't like. Work from home. Work from home. People became more productive working from home.
Absolutely. Workers do not need to be chained to their desks. Today,
Sorry, Jamie.
whatever, Jamie.
You know, just little tangent. My thing
Do
isn't
it.
his stance against work from home. You can have an opinion, but
Sure.
all the leaked audio that it is, he's so angry about it.
Angry.
Do you need to be that angry about that, man?
Nope.
You don't you can be like, I don't believe work from home works for this particular industry. There needs to be some face time. 100% agree. There are certainly, you and I
How much
are,
manufacturing does he have?
yeah,
Get the fuck out of here.
0, right? But let's be the devil's advocate, right? Let's see it's the tone.
Yo, 100%.
The tone. Just like the judge said on the Good Place. It's the tone.
It's the tone. It's the tone. Yeah. So
Wait.
today, here we are, 5 years later, over 25% of paid work days, just over 25% of paid work days are now worked from home, as opposed to 7% pre-pandemic. And one of the major things that it improves is retention. So, which we've seen, right? And right now we're seeing this. I keep reading about the return of big boss era, like where these CEOs are, more empowered to have this like get to the office or get fucked kind of attitude, which, you know, y'all should see the
See my face.
scowl on Linda's face right now.
Why
Uh,
can't we talk about it? Why can't we just have a system that works? I have to say in our office, I think we have a great system. Like we I
Fantastic.
think I think we do it right. I think
You do.
we do it wonderfully. But yeah, the scowl on my face was loud.
But it is now proven 5 years later that it improves retention, and that people and your best workers are most likely to stay when you provide that flexibility, assuming they're in a role where that flexibility is allowed, right? Like
Right.
manufacturing in a lab, of course. Um, this is first world problem with the flexible work days, but
Yeah.
uh, but it works to have that flexibility. So yeah, that was a big one.
Do, do.
All right. I mean, you've gotten a lot of them. We've got one, two, three, four, five, six, seven left. You got more than half already.
All right.
There's still some really interesting ones on here.
Yeah, I probably will never guess those.
Well, that's
The
I'm not
more
gonna make you guess all 15,
No,
but
no,
you're
I
doing
know,
great
but
so far.
how ironic is it that we're on the Interesting AF podcast and I can't even, think of the most interesting facts in this article?
Because it could be one of a billion things on
Yeah,
this
of
list.
course.
Like, we
Yeah,
learned a lot of interesting things about human nature and
yes.
nature in general during lockdown that, like, I found this list really interesting for sure.
Um, I'm gonna go for one more and see if I can figure this out.
Yeah, if you
Probably
go for one more, then I'll read you the rest.
all right. There's got to be something more in health that we haven't gotten, or work or something. Or people. I mean, people. Oh, oh. What did we learn? Now I'm like, we learned nothing.
We learned
Life is
well.
meaningless. We learned nothing. Life is meaningless. Um, we probably learned that our infrastructure isn't as good as we thought it was. Like internet infrastructure and like connectivity or something. I don't know, something like that. That we
So
need.
that's not on there, but it's a good one, right? I think
Yeah.
we witnessed the overhaul that our company had to do. I mean, you want to talk about Congress? They were so behind.
So
Everyone was still
behind.
using Blackberries, and no one, like, the option for virtual meetings was non-existent.
Yeah.
I cannot stress that enough.
Yeah.
And I was actually impressed with how quickly that all came about, to be honest with you. But I
Hmm.
agree, like, you needed good internet, you needed bandwidth, you needed good virtual cameras, and
Yeah.
so yeah, I think a lot of people had to face that for sure. So one that I'll do,
Okay.
again, in no particular order, is computers. Since we're on computers, are not a replacement for a classroom. Like,
Yeah.
the data is very clear on this. Remote school was not enough. And I don't think anybody thought it would be, to be like, I don't think anybody sat there being like, well, this is clearly going to be fine. I don't think anybody thought that, to be honest with you. But across the US, in both whatever this study classified as rich and poor districts, math and reading test scores fell. Many students haven't caught up. There was learning
Yeah.
loss even in countries that had shorter school closures than we did. And just kind of across the board, this was, uh, you know, not
Not
good.
great.
It was not good.
Yeah. I think, and, and this is like a wider discussion. I think we're going through a huge moment of transition, and we're trying to figure out how these tools like computers, AI,
Yeah,
kind of fits in our learning kind of toolbox, because all this stuff are these are tools, everybody. They're not end all catch all, right? They're
no,
tools. And we're not using them appropriately. And I think we still haven't, unfortunately. And I think many governments, many policymakers are not thinking through what we need. And I think, with remote school, and, we didn't have like school age kids.
right.
But I think if you're just honest with people, it's like, hey, we're doing the best we can. We want to minimize the kids being exposed to this virus that we know nothing about. We don't know the long-term effects. Yes, we're trying to figure out as we go. Let's lock down. Let's see what happens. Let's try to put some mitigation methods. But I think that was the lack of, and this might be another one with like a lack of trust among government, health authorities around anything, right? Trust probably plummeted because that's something we learned, because we didn't people didn't know how to communicate about a very real threat. Um, and I think, and then you see the dichotomy of how different types of people took that uncertainty and ran with it.
Yeah. I'm going to keep it in the kid category with the next
Let's
one,
keep it in the kid category.
which, like, this one, our blood may start boiling with this one. There's a simple way to bring children out of poverty. The monthly checks. Okay. Linda's face. It's a podcast, so I'll just mention it. I can't, like, yeah, like, no shit, Sherlock, again. The monthly checks from the federal government brought children out of poverty. The money that was, right? The money sent was used for its intended purpose, which I think a lot of people would say, why are we sending away free money? They're going to do this, this, and that with it. No, it was used for the intended purpose, which is food, childcare, healthcare, housing. And not only did it bring children out of poverty, but holy shit, guess what? It improved parents' mental health and overall family well-being.
Look, a family-friendly policy.
What the fuck? It's that simple.
It's actually conditional cash transfers, like, not unconditional cash transfers. Usually when they are sent, they actually work globally. Like,
Yeah,
they've
they've never not
never
worked.
they've never not worked. Of course, there's always, like, a small percentage of the population, but what basically how you set it up is you set up, like, certain criteria, and you go, "Oh, these kids are already in school. These parents have jobs." And basically, you just supplement to ensure that these families can, make it through.
Yeah, yeah. Uh-huh. We'll leave it at that. The facial expressions have been on fucking point today, Linda.
Well, I'm really glad I didn't read the, fucking article 'cause, I would have thrown my computer out the window.
Yeah, yeah.
I'm glad I'm
Uh,
hearing it from a friend.
yep. Uh, Spoiler alert. Teenagers do, in fact, need more sleep.
Yeah, I could have told you that one. I'm
I
still a
didn't need
teenager.
No, I didn't need a study for that one. I need more
Yeah.
sleep all the time too. So during lockdown, they started sleeping more according to their natural rhythms as opposed to school
Yeah,
schedule. And getting the sleep they needed improved concentration, behavior, attendance, learning, and mental health.
makes sense.
No doy. No doy. Okay, so these next ones are actually I'll do this one first and then we'll finish out with the ladies.
Oh,
There's
the
several
lady.
on us lovely ladies.
Oh,
This one I find
lovely.
really interesting. Not shocking, but like I love that this is one of the lessons. Home field advantage is real, but it is because of the fans for sports teams. Yeah.
Oh.
So home teams played worse without fans around, even if they were playing in their home stadium, arenas, ballparks, etc.
The
Um,
hype. It's the hype. It's
it's the hype, it's the camaraderie, it's the cheering, it's all of that, which totally makes sense.
right.
And it was so weird to watch all these sporting events with no fans. Like we were watching soccer games, we're big golfers, so like watching the Masters with nobody there was weird as shit. Like
I bet.
football started their preseason without people in the stands. I mean, it was so weird. It was so weird to see. Um and they also through all of this were able to study the impact of jet lag on athletes because so when the NBA started coming back, they took I think like 20 teams
Mhm.
and they all played in Orlando, Florida. And all of everyone's stats went up and they realized it's because they didn't have to be bopping around the country in different time zones and whatnot, the day of or the day before a game. And so literally every stat went up. Scoring, rebounds, assists, like all of it.
Makes
Um,
sense.
which does totally make sense. And I would never, ever advocate to say, like, let's play all football games here and all baseball games here. But like, there is something to it, right?
But maybe
Which I think is
maybe
fairly
let's
obvious.
time it better for everybody and
Yeah.
everybody involved. But it's interesting. What's more interesting is that we had to prove the negative first.
Hmm.
Like, we were still doing all these games and all that stuff and until we had to put them all together because we had this raging pandemic happening where we had to go, "Oh, wait. This is not good." Like
Right.
the way we're doing things is not the best
Not
maybe.
always the best.
Let's you know, it's not like giving people money so they can eat.
Oh, well, these next two are gonna also like just I'll start with the ones that will like piss you off the most and end with the one that I
Okay.
think is funny, but also like I'm gonna use this the rest of my life. But so this one, like infuriating. Not even being stuck at home makes men do more housework. Even when men worked from home, women still handled more of the work. 8 out of 10 mothers said they managed remote schooling. That could be why mothers' antidepressant use increased, but not fathers. Mothers were more likely to cut back at work. The list goes on. This isn't even that's not me saying it. This is this article. This is facts, guys. This is data. This is numbers.
And also, we don't even need the numbers. Everybody
Yeah.
that's listening knows this 100% that this happened. I mean, I went through it. I know I went through it. God bless.
Amen.
Oh my god.
Thing.
All right.
Women are better patients than men. Yeah. I mean,
In the sense of we don't like get angry or what?
so they didn't mention that, but we were more likely to wear masks, get vaccinated, follow other public health guidance, which you mentioned before, but not just in the US, this is globally. And women are more likely to seek preventative care, visit doctors, follow health recommendations in general, which could also be why we live longer. They also
Yep.
did say, though, that men who lived in a household with a woman or women, their numbers were higher too in terms of getting vaccinated, wearing masks, going to preventative care, all that stuff. So clearly,
Yep.
we're just good influences.
Yep.
Okay,
Women
so that,
tend to be in families, they tend to take care of the health of their entire families, husbands
of course.
included, but it's not the
So
opposite.
this is we're on number 15.
All right.
We're on the 15th one. This one I'm going to use forever, and because it paint like just thinking about them hurts my feet. High heels are not just uncomfortable, they are dangerous. There were less women in the emergency rooms, and injuries from wearing high heels, fractures, sprains, etc., declined sharply during lockdown. And so
Makes sense.
I've been out on high heels for a long time just because I played sports my whole life and my hips and back are a fucking disaster because I was trained like a man my whole life. So I've been out on high heels anyway. But now I have proof that
You
I'm
have.
being a safer, healthier person for not wearing.
That's awesome. Yeah, yeah, definitely after COVID, like I didn't even wear that high heels, like much high heels, but like, kitten heels or like something like that. But like I always needed not to go TMI, but one hip is shorter than the other for me. So like
Hmm.
that's like so actually a heel balances me out, ironically,
Nice.
because it's like puts you anyway, but yeah, fuck heels. And the only ones I use now are block heels. If I do
Yeah,
have
yeah, yeah.
heels, it's block heels because those
Block
are a
heels are
lot
like a
easier.
chunky boot.
Exactly. Yes. Thank you for yeah. I mean, I wouldn't have known that a couple years ago. So thanks for the
I thought that was interesting, right? So yeah, there's your
yeah.
15 things that scientists learned during the deepest, darkest depths of lockdown, according to the New York Times.
I love how like wide breadth this was. Like
Yeah,
it wasn't
exactly.
just like one thing or another. It was like
Yeah.
really a big thing. And also, this will remind you that AI is not going to replace us, everybody.
No, I can't.
It can't.
Not
People are
yet.
people. People are people. I know, yesterday Gates was like, "Oh, in 10 years, we're not going to have doctors and we're not," and you're like, "No, probably not."
No, I don't think so. They said we'd
No.
have flying cars by now, and we don't
Yeah.
have. I mean, I've seen one, but like
Yeah.
no,
Where are my lace up Nikes? Ready?
seriously.
Pump
I'm a
it
hoverboard
and you hoverboard.
and Jaws 25.
Like I
That's
want
a
to
Back to the Future reference for our younger
go
listeners.
go watch the movies.
Go
Go
watch
watch
the
them.
first, all
All
three
3.
bangers.
I know people shit on the 3rd one, but
No,
I
it's good.
love the 3rd one. The Clint Eastwood reference, I mean, who does not cheer at that scene?
I know. All three of them are good. The first two, I would argue, are the better ones, but the third one is
Fair.
so good.
Except I accept the ranking. I would go 1, 2, 3. They're actually
Yeah,
ranked
literally one, two, three. Yep. Yep.
literally ranked 1, 2, 3.
Yep.
Um, but the last 2 seconds of the 3rd one of the 2nd one is awesome. Like where
Oh
he
yeah.
gets the letter
Oh yeah.
and he's like, "Ah." Anyway, and then you have to wait for the
Great
3rd
movie.
movie to read the anyway. You wanna go watch it real quick? You have
Yeah,
time to
I do.
kill.
All three of
Um,
them. We'll go watch all three.
all 3. Um, but yeah, well, that was great. I learned a lot. That was a I mean, and it's things that
I had fun with that.
you think that you don't know, but like you do know somehow, but you also like, you know. But yeah, wow. So we'll link the article, the New York Times. Tell us what you've learned from lockdown.
Yeah.
I think we're not talking about lockdown, COVID, or anything as much as we can, because we are just like stuck in that trauma response where we want to
Yeah.
pretend like it didn't happen. But the more and more we talk about it, go back to our generational trauma like episode, the more we talk about it, the more we accept lessons, the more we think we can move on, and learn from it and find happiness eventually. And this is corny, but it's the rest of us. Like when we're all together, we can find solutions and we can find, ways to move forward in ways that are healthy, supportive of other people, and inclusive.
Yes. Amen.
Well, with that, so I think we talked about what our next episode's going to be. So it's going to be the doc is in Sir David
Sure.
Attenborough,
Yes.
Sir. The year our world changed, right?
Yes. The year the world changed, the year the earth changed. It's less than an hour, so it's a real easy commitment. I think it's on Apple TV Plus. You might also be able to get it on Amazon Prime.
Perfect. Well, then
That's
there you go.
really good.
So that's our next episode, and we will discuss it. I haven't seen it, so it'll be the first time I'll see it, and we'll discuss it. But otherwise, again, tell us what you've learned. Email us. Our emails are open. Our email is open. And yeah, as always, Elaine, take us out.
Stay interesting.